Welcome to ASLM's special COVID-19 session number 12. This is a series that we have dedicated to diagnostics in the COVID-19 pandemic response. Today, we are focusing on an important subject of facial masks. My name is Anafi Mataka from ASLM, where I serve as a project lead for our United funded efforts in accelerating adoption and integration of innovative diagnostics by national health programs, as well as a project manager for the laboratory systems, strengthening community of practice funded by the Bill and Melinda Gates Foundation. I'll be your moderator today. This will be a 1 hour long session, after which we will get a presentation for about 20 to 30 minutes, followed by questions and answers. Kindly remember to put your questions or comments into the chat box as the session continues. Like I said, we are focusing mostly on an important subject of facial masks during the COVID-19 pandemic. This has been a topical subject indeed. You agree with me that there have been so many questions around masks, sometimes also misconceptions, and the social media we have in the present day doesn't make it any easier. There have been questions like, can face masks help prevent the spread of coronavirus disease? If so, why weren't they recommended in the first place when the pandemic started? What are the different types of masks that are available out there? And how do they work? To help us look at these issues, we have one of the best brains when it comes to this subject in the name of Professor Yi Cui. Professor Yi is a professor in the Department of Material Science and Engineering at the Stanford University. He received his Bachelor of Science in Chemistry in 1998 at the University of Science and Technology of China. And then later on, he got his PhD at Harvard University in the year 2002. Thereafter, he went to work as a Miller postdoctoral fellow at the University of California, again in the US. In 2005, he became assistant professor in the Department of Material Science and Engineering at Stanford University. He has published approximately 480 research papers and has an H index of 197 according to Google. In 2014, he was ranked the #1 scientist in material science by Thomson Reuters as the world's most influential scientific minds. He is also a fellow of the Materials Research Society of Electrochemical Society and Royal Society of Chemistry. He is also an associate editor of Nanoletters. Again, he's a co-director of the Bay Area Photovoltaics Consortium and a co-director of Battery 500 Consortium. He has a lot of awards to his name. For example, the Dan Maiden Prize in Nanoscience in 2019, just last year. And also the Blank Van Dyck National Laureate in 2017, amongst many of his awards, including the ONR Young Investigator Award way back in 2008. He has founded 3 companies to commercialize technologies for his group, which is called Amperius Inc., 4C Inc., and the Innovate Technology. Ladies and gentlemen, we are honored to have Prof. Yi today to discuss this important subject. Let me hand over to Prof. To take us through the presentation. Over to you, Prof.
Well, thank you very much, Anafa, for your invitation. Let me try to share my screen. Can you all see it?
you need to put in the presentation mode.
Okay. Swap the display. How is it right now?
Perfect.
Okay. Well, thank you very much for the invitation. So today I want to spend the next about 1 hour or so to introduce to you what I learned about facial masks, specifically related to homemaking, disinfection, and imaging. This work it has been the one in collaboration with a lot of people. At the bottom right here, you see the collaboration with inside Stanford, Professor Steve Chu, Larry Chu, Hua Chu, and Amy Price, and the 4CL team of a few PhDs right there. And also the demand team, particularly Professor Mei Chu in Colorado, Xiao Chen and Brian and Yingling in WHO. So when we start to talk about facial masks, we need to understand the size of the COVID-19 first. Drawing on the left right here is a COVID-19, about 150 nanometer in size, or say 0.15 micron. It's in the size regime similar to other coronavirus, happen in the history. You look at HIV, you look at influenza right there. They're in a similar size regime. This size is very important to consider. Once the virus forming the aerosol or forming a droplet when people are speaking, what's kind of minimum size you should be thinking about. Of course, these viruses, they could be in the size different from their intrinsic sizes. They exist in a droplet. They might be compound together with protein and with salt, with other components together, and the size will get bigger. But this will be the minimum size we should consider, about 150 nanometer also. And now the question Anafa was asking, right? So whether it's necessary to have facial mask when you want to wear it. Let's look at two people in communication right here. And one person is speaking, and there's a lot of study already during speaking, and there's many droplets of saliva coming out, many of them. Some of them are big, larger than 10 micron. Usually they are going to fall down fast. And there's a lot of study indicating about 6 feet also. That's why you want to keep social distance 6 feet. In some of the weather condition, it might need more than 6 feet. But 6 feet is common to be recommended. The big droplet will drop down, but a small one with evaporation particularly, and we'll get into the another person's respiratory system can go down to the lung and infect people, and typically less than 5 micron. Also remember, during evaporation, this droplet can become smaller, let's say down to about a micron also or smaller. It forms the aerosol. And once it forms aerosol, it's going to float on the air for a long time, a number of hours, even days. So that's why wearing facial masks is important, particularly in the indoor environment. In the indoor environment, typically there's no good air exchange with outside, and there's many people in there. You want to wear a mask. And then in the outdoor environment, if it's crowded, when 6 feet, I think to be safe, even 10 feet, the social distance cannot maintain, then you should consider wear facial masks in the outdoor environment. These masks are trying to have two functions right there. One function is when people are speaking or coughing or sneezing, wearing facial masks will help prevent a lot of droplet going out directly to outside. And on the other hand, to try to protect individual, when you wear facial masks, right, these particles, these droplets, and then the aerosols floating around, it's harder to get into you to reduce the probability of that. So facial masks will be quite useful in both. So let's look at the facial mask basic structure. A facial mask will need to have a filtration material. Sometimes we call this a filtration media, and it consists of these fibers, right? And the facial mask commercially available, these fibers. And air coming in, carrying these particles, you want them to capture those particles without the particle going through. And these fiber size typically have diameter 1 to 10 micron, made by the process called melt blown. It's a polymer that's usually polypropylene, so we call that PP, forming the three-dimensional structure with porosity 90%. And this high porosity is allowed air to go through fast. But these fibers alone will not have very high filtration efficiency, just these fibers alone. And it oftentimes requires electrostatic charge to increase the particle capture efficiency. Once you have electrostatic charge, the basic physics is teaching you, it creates an electric field. And the fiber that, with certain diameters, right there, electric field line going through a fiber like this way, right? So it's not uniform. So these are non-uniform electric field and can polarize these particles coming in, whether it's virus or bacteria or other, particles, and polarize those and attract these particles towards the strongest electric field that's on the fiber surface. So typically they're made by spun bond 1 to 10 micron. There's also another type of fabric called, made by melt blown. There's another type of fiber made by spun bond, bigger diameter. Spun bond usually is used as a supporting layer to support melt blown. Melt blown fibers are smaller, mechanically they're not strong enough. Then you need a spun bond to support that, forming a sandwich structure. So it is this type of fabric structure that give you high filtration efficiency. That's the basis of making an N95 level of mask. Whether it's N95 or KN95, these different countries has a slightly different name right there. But let's just use N95 level to indicate the performance reaching 95% filtration efficiency for 0.02 micron sodium chloride particle under 85 liters per minute. This is kind of standard testing defined in NIOSH in the United States, CDC. The first topic I want to talk to you is homemade masks. And it is a significant shortage of masks, whether it's N95 or surgical mask. Number one questions we want to ask is whether we can use the household materials to do the homemade mask, having reasonable filtration efficiency, right? This is a project I work closely together with our team called Demand Team and WHO, particularly Professor Yi Cui. She's leading the whole team right there. And May in Colorado and United States here. And his team is making this community mask and send over to us to do the testing. This community make mask consists of 4 layers, right? The 2 outer layer, they are cotton, but the 2 inner layer, they are polypropylene. This is called olefin, available in the market. And May send us to this mask. We use our procedure, or in the mask level is similar to NIOSH N95 measurement of procedure using standard instrument 8130 TSI. This is the machine for measuring filtration efficiency and also measuring for air pressure drop. And air pressure drop is indication of breathability. The lower the pressure drop, the better the breathability. And the flow rate 85 liters per minute. Let's look at the right-hand side data. Let me point to you this data right there. Maybe I'll turn on my laser pointer. So you could see, well, these community make mass filtration efficiency for the 0.026 micron particle, right? Very small sodium chloride. Filtration efficiency is actually pretty good, about 40%, right? Pressure drop is reasonable, all below 100 par. Well, if I compare with N95 mask, N95 having typically pressure drop, a very good brand is below 100 par. Some of the brand can go up to 120 par pressure drop. So this below 100 is pretty good already for a community mask. And then filtration efficiency, this is about 40%. If you look at surgical masks available to doctor, right? The surgical mask typically, the requirement is above 30%. Some of them can go up to 40, 50, 70, 80%. There's a big variety of that. But this is already above the minimum requirement of surgical mask in terms of sodium chloride filtration efficiency. So these are pretty good community make facial masks. I myself is thinking about what's really needed for community masks under the non-medical use environment. I would say for the 0.3 micron particle, if I can get about 30% efficiency, I will be already very happy, as kind of reaching surgical mask and the particle filtration efficiency level. And then we start to screen further what kind of household fabric they are really usable for community masks, for homemade masks. So we look at left-hand side polyester, cotton, right? This is cotton from regular t-shirt. And there's a mix of fabric right there with a complex, component. Polypropylene spun bond. Indeed, polypropylene spun bond is also widely available in the household, in the bedding material, maybe pillow materials outside. And also the right-hand side is nylon. Right-hand side is nylon. And the testing condition is 8138. Now this is used in the fabric level testing. Our flow rate is 32 liters per minute. This is equivalent to when regular person doing breathing and the type of level of how much air exchange you are going to have is about 32 liters per minute. And the sodium chloride aerosol testing is this 0.26 micron particle. We also tested the paper, like kitchen towel on the left, the facial tissue in the middle right here, and also the Xerox paper, the printer paper used in office under the identical testing condition. Now let me share with you this testing data. This is a very busy table, but let me walk you through this. And we are taking materials, different type, different fabric materials or paper on the left. And then this is the source and the structure of that. What kind of process is used to make this material, whether it's melt-blown, spun bond, knitting, or weaving. The basis weight is also indicated here in this column. Initial filtration efficiency for this 0.26 micron sodium chloride, and the pressure drop. And then there's a quality factor Q on the most right-hand side. This quality factor Q consider both contribution of initial filtration efficiency as well as the pressure drop. The higher the quality factor Q, the better these materials will be. So this is indeed a very good parameters to indicate how good your materials is for making facial masks. So we need to consider Q, pressure, initial pressure drop, and also filtration efficiency. Now let me highlight a number of these materials right there. Let's look at polypropylene 1, 2, 3. This is PP. The first one as our baseline right there, then we know our measurement is all good. This is a melt blown. 25 GSM, filtration efficiency is close to about 96%. Right, this is using N95 mask, these materials. And its initial pressure drop under 32 liters per minute is 9 par. Its quality factor is very high, 163. But this is very high. That's why filtration efficiency is so high. Air pressure drop is decent, not very high. Good breathability. Then we look at two types of surgical masks available to us. And it also uses the melt-blown inside, but its filtration efficiency is low. It's not 95, 96% anymore. It's 33%. The other one close to 20%. Air pressure drop is here, 16 par, 34 par. This quality factor dropped to about 5 also. This is indeed used in surgical masks. They don't have an electrostatic charge in there. And the N95 level of mask need to have static charge, otherwise efficiency won't be high enough. Now let's look at the household materials. This is another polypropylene spun bond process, and 30 GSM gram per square meters basis weight. And initial filtration is low, 6% for this 0.26 micron. But its air pressure drop is also very, very low. Its quality factor is actually pretty good, 17 right here. Imagine if you take about 5 to 6 layers of these materials of polypropylene, you are going to get to about 30% filtration efficiency. And if you take 5 or 6 layers right there, your pressure drop is only about 10 par. You are actually having a decent facial mask right there in terms of efficiency and breathability. 10 par is very low pressure drop. So now let's look at cotton. I understand there are a lot of cotton materials available in Africa. We take 3 different types of cotton t-shirt right here. They're either made by woven and knitting process. This is their basis weight. They're thicker, 100 gram, 150 gram, 360 gram of basis weight GSM. Filtration efficiency ranging from 5 to 26%. Air pressures drop, 5 to about 17 par. You look at the quality factor, they are similar, and 5 to 7 also. So this actually looking at this quality factor 5, 7, this is pretty good number. Indeed, cotton can be used and to make a reasonable quality of facial mask. Particularly, let's look at cotton 3 right here. 26 par of pressure drop, 26% of filtration efficiency, 17 par of pressure drop. And imagine you take this cotton 2 layers together, and you can actually reach this 2 layer easily about 40% of filtration efficiency. Pressure drop double this is about 34 par. And you can have a facial mask for particle filtration reaching close to surgical mask already. Let's look at polyester. Polyester is also widely available. This is the one we are testing. Is a knitting process, 200 GSM, 17% filtration efficiency, 12 par pressure drop, quality factor close to 7. Also pretty good materials. Silk, quality factor is lower. It's about 3. And its filtration efficiency is not that high. Air pressure drop, of course, is low, but after you consider both, is about 3. I think still usable silk, not as good as cotton or polyester. Nylon one, this one is woven structure, and its air pressure drop is too high, 240. Filtration efficiency is reasonable, 23, but its quality factor is low, it's 0.4. It's too low, this type of nylon. Now let's look at cellulose. This is the paper I referred to. Even kitchen towel has quality of 4. You look at the facial tissue. Let me point out the facial tissue to you right there. But this facial tissue is indeed very thin. I have one right here on my table. This is commonly available right at home. Its filtration efficiency is 20. It's actually pretty good. air pressure drop is 20, quality factor is 5, similar to cotton. Imagine you have 2 layers of this facial tissue, and you can already reach about 35% filtration efficiency. Now 40 tall, still very, very good facial mask, I would say, you know, for household use. And then the A4 paper, right? The filtration efficiency is very high, but breathability is very bad. Quality factor is low, so not recommended. Let's look at this and say, well, what's the reason? And these material, they have this quality factor. Let me point you to this. This is the scanning electron microscopy image, all of these materials. The top row, A, B, and C is PP, polypropylene, right? Polypropylene 1 and 2, they are made by the Melbourne. If you look at the fiber diameter right there, these are the scale bar, you know, the left side 300 micron, right side 75, more zoom in. They're about 1 to 10 micron in diameters. They all have this porosity, somewhere about 10 to 30 microns also. But polypropylene 1 has very high filtration efficiency. It's about 95, 96%. Polypropylene 2, you go back and take a look at this. Polypropylene 2 is dropped to 33%, much lower. You look at their morphology, they're not too different. The big difference is polypropylene 1 has electrostatic charge in there to increase the filtration efficiency. Polypropylene 2 doesn't have that. Now let's look at cotton. Well, focus on cotton. I think this is important to individual person for the household to use. Cotton 1, 2, and 3. Remember cotton 1, if you come back cotton 1 right here, filtration efficiency is low, but 2 and 3, they are high. But 2 and 3 have very different basis weight. It's not entirely due to the base weight. It's actually the microstructure is so important in there. Cotton 1 filtration efficiency is low. I point you to see these big holes right there. Look at the scale bar. This is 300 micron. We are talking about 100 micron holes right there, exists right there roughly, right, 100 micron. So you're going to leak out a lot of air. You leak out a lot of particles. And then 2 and 3, the same scale bar on the left, you don't see those big holes right there. It consists of this fiber, but you don't see these big holes right there. So it's kind of the weaving, it's tighter, but it still has some small holes to let the gas to go through, the air to go through. That's why 2 and 3, the quality factor is higher. You look at polyester, it has all these small holes right there, no big holes. Quality factor is reasonable. Polyester is great. Silk is this weaving is too dense, and nylon, this weaving is too dense, really too dense. Remember, I told you the nylon air pressure drop is too high. Its quality factor is low. Now let's look at paper. Paper towel, the tissue paper. Tissue paper has highest quality factor among all. He has these small pores right there. It doesn't have the big pore as the paper towel. Paper towel pore is big. And printer paper doesn't really have pores. Those are 10 micron, 30 micron size pores. So printer paper's quality factor is low. Air pressure drop is very high. So we can at the end come back to correlate. So number 1, right? If you want to learn what causes this, number 1 is microstructure. How does fiber arrange? You want to have those micron size, 10 micron size pore, but not 100 micron. Basically, that's the conclusion. And then to increase the filtration efficiency further, once you have the right microstructure, is you need to have static charge in there to increase the filtration efficiency. It's really motivate us to look into whether all these materials, we can generate a static charge to really increase the filtration efficiency. Now, let me show you a video. How do we generate static charge for household to use? We are not going to be able to use colonna charging, right? It's a process using colonna charging to charge up this fiber. That's a commercial, an industry scale. That's how people make N95 facial mask materials. So can we do easy static charge generation? So we develop a method that's triboelectrical. You take the gloves, basically using a rubber. In this case, is this a typical gloves type of using in the lab, right? This is latex rubber. You just rub on these materials, and then we measure the filtration efficiency. Use this standard TSI 8130 machine. We can read, the pressure drop, and and also the filtration efficiency. So now right here, let me see. I lose my cursor. So now right here, I want to show you is these different materials, right there, cotton, silk. We basically charge up all of these fabric using the static charge. And for each fabric, left-hand column, right, this bar chart, and the right-hand side is before and after. I want to point you to the polypropylene. And polypropylene has the biggest improvement right there in the before and after you compare that, because polypropylene can be charged with static charge easily. Also, nylon is also good. Silk is good also. Cotton is not good. So remember, to charge your cotton like this is very hard. It makes sense. Cotton is so hydrophilic. It can absorb water molecule on the surface. Very hard to do static charge on there. We know if you wear cotton, unless you go to winter time, it's very dry, then you can start to see some static charge on cotton. Otherwise, it's very hard. And then we also compare A and B on the top, right there, A and B. That's if you generate static charge, your filtration efficiency, it can be increased a lot, but how long can it last? And nylon, polyester, and polypropylene and silk, they can hold it for quite long, A and B. You look at the data. This is an ambient condition. You can wait overnight, they look fine, particularly nylon and polypropylene. However, if you're in a humid condition, if you use it for facial mask, you're going to breathe out a lot of moisture right there. It's very humid condition. Under the humid condition, we discover nothing else works except polypropylene. Nylon will lose static charge fast. Polyester will lose static charge fast. Silk will lose electrostatic charge fast. So C and D right here, and these C and D and this plot right there is polypropylene. Only polypropylene PP can survive. So that's also explained to you why facial mask materials, right, N95 surgical mask inside internal layer, the one having filtration efficiency is made of polypropylene, but that's because that's the one that can hold static charge for months and years, to guarantee high filtration efficiency. So let me also, let me do one thing. Let me end this slide and go into presentation mode again. So I can bring by my laser pointer. So now let me, rank all this material, right? Just to get you to remember maybe more. If I do the ranking, I think using Q factor is as the first parameter to rank. That's a good idea. And then you are going to look into a second parameter is detailed filtration efficiency and air pressure drop. Polypropylene meltblown after charge, this is the best. This is using N95. The second best is the polypropylene available, the spun bond in your house. And if you can identify these polypropylene materials, you do the triboelectrical static charge. This is really good. Quality factor go up to 30. If you don't do the static charge, uncharged one, quality factor go up to 15. Very good one in these materials. If you have multi-layer stacked together, efficiency is very high, air breathability is very good. The next one I would recommend is cotton. Cotton is actually decent. Quality factor is 5 to 10, right? You have about 2 to 3 layers together, for some of the cotton, you are going to reach more than 30% filtration efficiency for 0.26 micron. Let me also mention to you, if it's 0.26 micron, 30%, translate to the size of like 2 micron, 3 micron size droplet, or the particle size, the bigger one, you are actually reaching 90% or 95% filtration efficiency, sometimes even higher already. So 34% for 0.26 micron can be really good for big particle, 90% filtration efficiency type of level. Polyester is a reasonable, quality factor 5 to 10. This is another polypropylene meltblown. This is uncharged one about 5. This is used in surgical mask. So I would say facial tissue, that Kleenex, the brand, is indeed pretty good. And facial tissue, it can be useful, quality factor about 5. Silk is okay, quality factor is a little bit lower. But nylon, so far, we have been disappointed about nylon. This is a very strongly woven one. But when I say this, I don't rule out the possibility. Some of the nylon, depending on how you weave, how you knit, it might be good as well. But so far, the one we test, they are not so good. So I would say a safe bet looks like cotton, right? And then it's polypropylene, right there. Cotton, because we test multiple types of that, that they look reasonable. The reason I bring up cotton is also because the last week also, we are testing the cotton material from Africa. Professor Yi Cui, spent some time in Africa before to help Africa, fighting the pandemic. She has some collection of t-shirts from Africa, from Kenya, and from West Africa, right? These are the 3 types of May offer to us. This is the testing we put into 8130 machine, our standard testing instrument, and the flow rate 32 liters per minute. Now, let me show you this testing data. Efficiency, they varies 15%, 8%, 7%. This is for 0.26 micron sodium chloride particles again. Pressure drop 25, 17, and 7. They are actually very low pressure drop. If I calculate the Q factor right there, they reach about 3 to 4, roughly within this range. I would say they are in the usable range. They are a little bit lower than the cotton materials. I'm testing this white collar cotton I show you, but they are reasonable. So for example, if I would take this t-shirt from Kenya, 15% filtration efficiency, right, 1 layer. If I put 3 layers together of these materials, I can entirely get to roughly about, getting close to 40% filtration efficiency. And air pressure drop 24 times 3, about 75 par. It's still within a quite reasonable range, I would say, very reasonable range. So this could be, entirely usable. So, this is the research about the household mask. Of course, what's important down the road, I think, is to come up certain, kind of I would say, the empirical rules for individual household by looking at it, by touching it, by breathing on it. They could judge these is reasonable materials to use, and then how many layers they need to use. So we try to come up the procedure for people to be able to tell, the layman to be able to tell. Of course, it's hard for individual household to have a machine like this to measure filtration efficiency. Not possible yet. But we come up certain rule to correlate. We know the microstructure, we know the performance, maybe to help guide the general public on what type of materials to use. Well, in the remaining time, I need to speed up a little bit now. I use quite a bit of time. It's about N95 mask disinfection. I'm going to speed this up using next probably 5 minutes or so to make sure we have enough time for discussion. Different type of surgical mask or N95. But let me show you this picture. What's the internal structure right there? It's actually these 3 layers. The middle layer is meltblown. And the outer layer, the sponge bar, the middle layer is the one having high filtration efficiency. If you want to disinfect your N95, you want to do is, you want to maintain the N95, 95% filtration efficiency and above. And you want to maintain the similar air pressure job to tell people you don't destroy its structure, it's maintain its structure right there, integrity. So we are doing this testing. So let me point to you some of disinfection method. So initial filtration efficiency we measure right here. This is we use N95 male-blown fabric. And the two methods, and we screen right away. If you use alcohol disinfection solution, that doesn't work because it removes the filtration efficiency. More than 95% drop down to 56%, sometimes even lower. And the chlorine-based bleach also made the efficiency drop a lot. So absolutely don't use disinfection solution to wash your facial mask, to disinfect your facial mask, right? For the N95, because this removes static charge. For household materials, it's less of concern. Household material doesn't rely on the static charge to do the disinfection, but this is for N95. The steam reduces the efficiency a little bit. I want to point to the hot air treatment, the dry heat, maintain the efficiency well. But now let's look into the detail of dry heat and steam a little bit. Looking at the steam, the green curve, after 3 cycles, and get into 5 cycles, the filtration efficiency dropped too much. So not recommended of using steam to treat your N95. You reduce the filtration efficiency by a lot. And the dry heat, this is 75 degrees Celsius now, looks very good. 10 cycles, each cycle we do 30 minutes, looks very good. And then we look into the dry heat further, right? The dry heat now we do 75, 85, 100, 125, for different amount of time. So 125 becomes, this is too high, the efficiency dropped to about 90%. And below 100 degrees Celsius, dry heat looks reasonably safe, right? We got 20 cycles of treatment right there. They look good. Air pressure joy is more or less similar. You don't really damaging your N95 filtration fabric that much. Then we look into further. One of the temperature, 85 degrees Celsius, 20 minutes per cycle. A and B is and under different humidity. You can go to 100% humidity. They are still working. They are not, filtration efficiency doesn't drop. And for a dry heat condition, 30% humidity, we can run for 50 cycles, of treatment. And they still look pretty high filtration efficiency. So these actually lead us to, this is the male-blown fabric level, lead us to look into the mask level. This is N95 mask, 3M mask, and then 4CL mask, and another 2 brand. They're all having about 99% and above filtration efficiency, very high. Go through 85%, 85 degree Celsius temperature, 20 minutes this cycle, under 30% humidity and 100% humidity. That for each brand, we have initial, different humidity treatment, and different cycle. Their air pressure job is maintained. 4C, certainly this is the one my founded a startup company having actually very low air pressure job, very high quality mask right there. 3M is also pretty good. This other brand a little bit higher. So I'm trying to tell you is this N95 under 85%, different humidity, many cycles, they maintain filtration efficiency. Then you might want to ask the question, what temperature and treatment condition needed to cure COVID-19 virus? There's a study showing, actually multiple studies now in solution, 70 degrees Celsius, 5 minutes is sufficient to disinfect COVID-19, this COVID-2 virus completely. But dry heat condition is different. It's not in solution. One study showed 70 degrees Celsius, dry heat 60 minutes, disinfect all of the SARS-CoV-2. We have a collaborators in Texas. They also show us the data, and about 85 degrees Celsius, right? About 20 minutes, we can disinfect all the COVID-19. If this virus in there, don't add another protein like BSA. But with the BSA adding in, certain concentration, it requires 95 degrees Celsius dry heat. So then we say, well, this is really guiding us to be safe, to really see the facial mask, what temperature it can survive to maintain the filtration efficiency. We also studied 95 degrees Celsius, very humid condition, and a dry condition right there. And they can maintain reasonably, 20 cycles of filtration efficiency. Particularly if it's dry heat, it actually maintains it very well. The wet heat, 100%, 95 degrees Celsius, it dropped a little bit, but still maintain about 93% filtration efficiency. 85 degrees Celsius, all the humidity, they all look good. So, so in conclusion, this disinfection method, 100 degrees Celsius dry heat, I would say below 100, including 100, is safe for N95. Humid heat, less than 95 degrees Celsius, is also looking safe for N95. Let me make some comment about UV. We also studied UV. And UV can sustain 10 cycles, but UV we need to be careful because it's 5.3-dimensional structure. It's very hard for UV light to have uniform penetration. It's hard to control the dose. I would say it's very challenging for individual households or hospitals to do UV disinfection because you don't know what's the dose required to do that. Right? You need to do very careful study on that with good engineering control. There's a variety of methods. Ethylene oxide that can kill bacteria and viruses, but remember it's toxic. This needs to be, you need to release those residues, remove those to use. I would say it's challenging for individual household or hospitals to really know, how do you do it? And vaporized hydrogen peroxide, it can, also is toxic, very hard to judge. Whether you have complete hydrogen peroxide, completely remove the residue. And also hydrogen peroxide can react with component of your facial mask generating something bad. Be cautious. Chlorine oxide, for a similar reason, this requires good engineering control, ozone similar. So I myself wouldn't recommend this 4 method for individual household or hospitals to use. This requires good industry scale control to do it. So at the end, let me share with you, this mass, the particle distribution, right? We want to understand what's inside there. We do the X-ray CT measurement on this particle going to the fabric, from top to bottom. We can clearly see this particle, how do they distribute, giving you an idea. This is loading a lot of particles already, so certainly you are not going to breathe in so many of those particles into your facial mask. This helps us to understand how to design the better facial mask in the future. I also want to point it out, in the future, there's probably better technology based on the nanotechnology coming in using polymer nanofiber. We have been working on this for a long time to increase the filtration efficiency, reduce the pressure drop. And we have been seeing some of the really amazing video and how do we capture this particle and the dark field optical microscope using nanofiber, and their capture efficiency is very high. So let me summarize. At the end, the homemade facial mask, right? Having this ranking, what materials could be used. These are all possible materials could be used. And future direction will be how to develop the right procedures for laymen to use to judge what's the good fabric to use. This is ongoing. And for disinfection, looks like the dry heat, the humid heat, we identify the condition that could be used for the N95 mass disinfection. Let me end my talk by thanking collaborators. This has been great fun working with a number of folks at Stanford and also around the world. Thank you very much for your attention. I still have some time to take your question. Thank you.
Thank you very much, Prof, for the very informative presentation, and we appreciate this. Quite a lot of questions really came through from the chat. And I would like to make special mention of Amy Price and Yi Cui for responding to most of the questions that are in there. We will capture these and also share together with the presentation. I will take some chat. Let me start with this one from Caroline Mobangizi. And she says, Are health staff in facilities safe with surgical masks and not N95?
The question is this surgical mask, and what's the question again? Can you repeat?
Are health staff in the facilities safe when using the surgical masks and do not have N95 masks?
Yeah, certainly N95 will be better. So the surgical mask, we have testing now up to now a brand of surgical mask. Some have 30% filtration efficiency, some can go up to 80%. So I would say certainly wearing surgical mask, wearing mask is better than not wearing mask, that's for sure. Ideally you want it to be the higher the efficiency, the better. I mean, that would be my recommendation.
Yeah, so this is Yi Cui. If I could add to that, thank you, Dr. Yi, for really interesting presentation. So I think the WHO recommends that if you have to make some judgment, that the N95 should be only reserved, especially if it's not available easily, for aerosol generating procedures. They should be reserved for that. And that then other times, if you're working without aerosol generating procedures on a patient, a surgical mask is sufficient with all the other caveats for infection prevention control, like frequent hand washing and not touching your face, right? Over.
Thank you, May. Moving away from that hospital setting and maybe going home and coming back again, Mohaimana Vincent says, can homemade masks be used in a hospital setting?
So the homemade mask, compared to surgical mask, efficiency is one thing. I think homemade mask can get to surgical mask efficiency, but there's one more requirement for surgical mask. In the hospital environment, there's a lot of body fluid and the liquid droplet right there. So surgical masks typically have an outer layer that can block the liquid coming in, droplet. That's not, water cannot wet that layer. That's why surgical masks require passing the standard certain pressure of liquid by mimicking the body fluid, cannot penetrate through. That's, I think, the household mask couldn't have. But with that saying, it's possible to have a household mask if outside you add a hydrophobic layer, such as polypropylene, then you are going to increase the liquid barriers and getting close. This requires testing, getting close to the liquid penetration prevention function right there. So if you don't have anything to use in the hospital, so you run out of surgical mask, I would say you have to consider the community mask as well. Then by adding a hydrophobic layer, you could having the liquid prevention function.
Yeah, thank you also for adding that last point. I think that there was a question which was talking about the added value of adding that layer to the mask. So thank you for responding to that as well. Mm-hmm. And then going to the kids at school, I think there were quite a number of questions with regards to use of masks, especially in the young ones. And Gwen Stevens says, as children return to school, can you comment on the requirement to wear masks all day at school? That is something like 7 hours. Would this have a negative impact on the child's health?
Yeah, I mean, for the kids, this is a tough one. Wearing masks for a long time is, I would say, continuous 7 hours wearing masks. No, I wouldn't recommend it. But then how do you deal with this situation if they're all in the classroom? You want them to wear a mask. That's why I believe wearing masks is necessary in the classroom, but the schools to structure their schedule, for certain amount of time, whether it's 1 hour or 45 minutes, right? One class, everybody should go out, social distance further apart to take off the mask, breathing some fresh air for a while, and then come back to the classroom. Maybe something like that is needed. But continue 7 hours, I think it's challenging.
Yeah, challenging indeed. Thanks for that. Let's go back to this one from Sereke, where she or he wants to know, I think there was quite a lot of terminology in here. What is the difference between a fit test and a filter test?
The fit test and the for certainly fit test is very important, right? And it's telling you whether it's leakage right there or not. The difference between these two, and so I'm not entirely clear what at the end is entirely equivalent or not. This is something I don't have the answer for you. But this fit test, these a couple different methods to measure whether you have leakage or not. They all provide variable information, but which one is better, I'm not sure. Yeah.
All right. Thank you once again. And there were quite a lot of questions with regards to decontamination. You mentioned 70 degrees and how this could be done at home. And I have quite a lot of interesting questions around that. One is from Keen, who's asking, can you soak a 3-ply surgical mask in soap and then dry it in sunlight and reuse it in mild community exposure?
So surgical masks, right? So surgical masks, I think matching so many different brands right now. We see some of the surgical masks have electrostatic charge in there to increase the filtration efficiency to 70%, even 80%. Some of them probably don't have for static charge, they only 30%. We know if you soak it into the soap solution and your static charge is removed, your efficiency will drop if the static charge right there. So I wouldn't recommend using soap water to do it. You're going to reduce your filtration efficiency by a lot because many of them have static charge. I would say so far in the household, the heating method is, it's probably safer. Then you can say, how do I heat it? You can entirely also boil your water, to 100 degrees Celsius. And then by put your mask into a bag and, immerse that into water, as long as the water doesn't wet your mask, you can disinfect. So that's the one I know with our study, this will not reduce your filtration efficiency for the N95 and also for the surgical mask. But for household mask, it's different. Household mask has acrylic, there's no static charge in there. Then you can use your soap, you can do the regular, kind of like washing clothing type of washing. That should be fine.
Yeah. Yeah, thank you very much. And I think that picks up this question from Vasundara, who also continues and asks around use of pressure cookers, because he says he read somewhere that in China they used hair dryers. Was that okay to bring back the charge? And can somebody use a pressure cooker or dry oven similar to that as well?
Yeah, the pressure cooker, remember the temperature will go high and the pressure cooker inside, humidity, all the steam right there, right? Also remember, only polypropylene can be recharged, can maintain the static charge right there. Others cannot under the humid environment. So yeah, hair dryer, also be careful. There's a different type of hair dryer right there. Some can do general static charge. Some have a anti-static charge hair dryer. Also be careful on that. Yeah.
All right. Perhaps one last question. I know there are quite a number of questions that are there. And this one has to do with so many homemade masks that we are getting and how reusable they are. For how long can you reuse these?
So when I use masks, I think this is really depends on the environment you are using it. I mean, for me, I stay at home most of the time. Once in a while, I go out of home in US. Right here, I wear a mask. And I could actually use it for a month because I don't use it often enough. I just put it right there. I don't even need to do disinfection because I put it right there. For 4 or 5 days later, I will use it once. And you know, outdoor environment, even going to supermarket, and I stay for short time. Even it has some, assuming you have some COVID-19 contact right there, I get home, I put it to the side, and then 4 or 5 days later, you know, I know, you know, some people say 7 days later, but that's very high concentration of COVID-19 virus right there. So I feel comfortable we use it again. I don't even do disinfection. But if I use it every day, I would say about 3 or 4 days, you probably want to think about disinfection, do it once, you know, with that frequency. But if you go into a hospital, I would say you want to do it daily.
Okay. Thank you very much, Prof. There are quite a number of questions, but we are glad most of them have been answered. So our job will be to collect these and probably share with you those that have not been answered, and then we can quickly give back to our everyone who has attended together with the presentation as well. In 30 seconds, maybe your last remarks.
Well, I have been telling everybody a lot. I mean, my last remark is, well, you know, everybody stay safe. You know, we are on this together. Let's fight this COVID-19 and be successful. Stay safe. That's it.
Thank you very much, Prof. And thank you everyone for coming. We will share the slides as usual, together with the responses to this. Stay tuned, and we are going to be announcing the next session, which is coming on Thursday in a couple of hours. So thank you very much for joining. Till we meet this Thursday. Goodbye.